compared to the one who is positively taking your messages and following your instructions and all, right? So all these factors are there. And plus, as you know, the agent means what? Your microorganisms, the microorganisms, as you know, the plaque, right? The microorganisms, they ferment the carbohydrates and causing the by the enzymatic actions, and they will produce lactic acid, and which decreases the pH, and hence it causes demineralization, right? In simpler terms, if we say. So that's again a cause for dental caries. Likewise, there is environmental factors such as the plaque quantity, how much plaque is there, right? And what is its quality? And what are the enzymes and minerals present in the saliva? What about the socioeconomic status? So socioeconomic status also has a role to play, because the people or patients who are coming from low socioeconomic status, for example, they will be, of course, they may not be able to afford the dental services or the dental products, or they are not aware of the dental care, or they are not utilizing the dental services well. Okay, so all these factors will make them more susceptible to having caries, right? So all these factors, they take some time to interact and cause dental caries. Now, today we are going to talk about plaque. That means we have taken one of these factors and we are focusing on that. All right? Is it clear? Am I audible to you? Kindly write in the chat box. Kindly write in the chat box. Okay. All right, thank you for responding. So, of course, we have to focus on both the supragingival as well as the subgingival plaque. We have to remove both so that we can, prevent dental caries as well as the other problems such as gingivitis and periodontitis, etc. Right? So we are going to do what? The manual toothbrushing. That means you have to recommend to the patient the manual toothbrushing, right? And in addition to that, we have to talk about the flossing, which will remove the plaque from interproximal surfaces. And powered toothbrushes are also to be recommended in certain cases. And then we'll be talking about the dentifrices, its composition, and different roles of each of the components in a dentifrice, and then disclosing agents which are used for identification of the plaque. Okay, so different techniques of toothbrushing, we'll be talking about all this. All right. So, as you know, a toothbrush, it's having three parts: the head, the shank, and the handle. The shank, it's connecting the head with the handle, right? So, these are the bristles on the working end of the brush. The head has bristles, right? These bristles, they are arranged in groups. Okay. These groups are known as tufts, and they are further arranged in rows, right? You know it. So, here, what's more important for you to know and learn is that the lesser the diameter of the bristle, okay, of a brush, the soft it is. Okay, the lesser the diameter, the soft it is. So, of course, we recommend the soft or the medium brushes to the patients. We won't recommend the hard brush. Why? We don't recommend the hard toothbrush? Toothbrush having the hard bristles, we don't recommend to patients. Why? Anybody can give it a try? Okay, you're nearer to the answer. Yeah, we do. Okay, very good. So we do not, yeah, abrasion. Actually, we do not. Yeah, very good, Sarah. And a good trend knife. So we do not, want the cervical abrasion due to the hard toothbrushing, right? So we do not want that to occur. So that is why we will, recommend the soft and the, or sometimes the medium ones also, depending on the requirement, okay, as per the patient's requirement. So there can be different types of bristles also according to the cut, whether it's coarse, whether it is bulbous, whether it is round. Okay, so in when you are talking about a child, means your pediatric patient, right? So there we recommend a brush which is having a thicker handle and the head is small. Okay, why small head? Of course, because it has the child has a the old cavity is small, right? We want the bristles to reach each and every tooth surface, right? So that is why we will recommend a brush with a smaller handle, and the smaller head, and the handle should be thicker. Why? Because the dexterity, that means the grasping power of a child, is still developing, isn't it? So we want him or her to grasp it well, so we will recommend a thicker handle and a smaller head. Okay, and it has been seen, that by researchers, it has been seen that when they have studied, okay, and they have done researches for longer period, and they came to a conclusion that usually they saw that these bristles, they start wearing after 3 to 4 months. Okay, so that is why when you talk to a patient, whether it's for the children or their parents, everyone has to, you have to recommend that they should change their toothbrushes after every 3 to 4 months. Why? Because wearing of the bristles, you see, if the bristles are worn, what happens is that it won't be that effective in removing the plaque, isn't it? So that is why we will recommend to the patients or to the parents of the children that they should, change the toothbrush with a new one, the old one with a new one, after every 3 to 4 months. All right. So, flossing, of course, has to be done to remove the plaque from the interproximal surfaces, and we can use the manual. Floss can be holded by the fingers, the hand, or the floss holders are there. Okay, and also for the interproximal plaque removal, we can use the single tuft. The interproximal these brushes, single tuft brushes. Okay, so, floss can be, of course, different types like the flavored, the unflavored, waxed, unwaxed, thin, meshwork, nylon, or Teflon, made of which material it's made of, right? So, usually in children, we recommend flavored and the waxed one. So, whatever the type he or she is comfortable with, it's okay. But what's the main important thing is that they should, the patient should know the correct technique, how to use it. So that is your role, that you will, demonstrate to the patient its proper technique. Okay, so as you see in this picture, the middle one, the blue one, can you see this picture? The blue one, it is the floss holder, as you must have used or you must have seen it already, right? So the last picture, as you see, the blue one, okay, there is a floss threading device. What is a floss threading device? It is, similar to the needle. As the needle, we use the needle to pass the thread from one side to another, right? So likewise, see, if you get a patient and he is undergoing the orthodontic treatment, all right? So if he is undergoing orthodontic treatment, what will happen? You cannot, because there are arch wires which are fixed on the teeth, you cannot pass the floss in between the teeth, right, interproximally. So in such cases, in such patients, you will pass this floss, or you will recommend them to pass the floss using the floss threading device. Okay, where apical to the arch wire, they will pass this floss, right, at the interproximal area near the embragures, and then they can use it easily there. Okay, so that is where the floss threading device is used. Now, if we talk about the powered mechanical plaque removal, we have the powered or the electrical toothbrushes. We have the manual toothbrushes. I mean, we they are as good as the manual ones, and we have the sonic ultrasonic toothbrushes. We have the ionic toothbrushes. Also, it's not written here. So, what are the powered toothbrushes? They are the automatic ones, they are automatic toothbrushes wherein the high frequency oscillations are created. These oscillations, side to side movements, they will eventually remove the plaque from the teeth. Okay, so in which cases we will recommend the electrical toothbrushes is, of course, when the we have the handicapped patients, or we have the patients who are undergoing orthodontic treatment, or institutionalized patients, or you have young patients whose dexterity is not so well developed. So there also we can recommend electrical toothbrushes. Okay, and we have sonic ultrasonic ones, in which very high frequency vibrations are produced, by which it removes the plaque as well as the stains from the teeth. Okay, so sonic ultrasonic ones are more effective than the manual ones. And but when we talk about powered and electrical toothbrushes, they are as good as the manual ones. The ionic toothbrushes is a third type of toothbrush, wherein what happens is that they change the surface charge on a tooth. Okay, by the influx of positively charged ions on the tooth surface, they change the surface charge of the tooth. What happens is that plaque is also of the same charge, and it eventually gets repelled, because similar charges, they get repelled from each other, isn't it? So the plaque, which is of the same charge as the tooth, it gets repelled from the tooth surface towards that ionic bristles or the brush. Okay, so that is how it functions, the ionic ones, by changing the surface charge of the tooth, by putting some ions on the tooth surface. Okay, so the plaque, it gets removed as such. Coming to the dentifrice, the till now it's clear. Any doubts so far? You may write in the chat box. Do you have any doubts so far? Okay, all clear? Okay, all right. Thanks for responding. So, coming to the dentifrice, that means your toothpaste, right? That is what you're going to recommend to the patient on a toothbrush. They will be using the dentifrice, is the toothpaste, right? So, it has the composition, the components, there are constituents in it. So, each and every component in a toothpaste, in a dentifrice, has a role to play. Okay, for example, there are abrasives, there are surfactants, okay, there are antibacterials, there are anti-calculus or anti-tartar products in it, and there are desensitizing agents also, there are flavoring agents, coloring agents, right? There are fluorides, which are anti-caries, right? So all these is having a role to play. For example, the abrasives. Which are the abrasives? For example, calcium carbonate or alumina or silica. These are the abrasives that are found in the toothpaste, right? So surfactants such as sodium lauryl sulfate, these abrasives and surfactants, they will help in what? In the plaque removal or the stain removal. Okay. Likewise, if you talk about fluorides, you know what's the function of fluorides? Antibacterial or prevention of caries, right? So, fluorides such as sodium monofluorophosphates or sodium fluorides, they are found in the toothpaste. So, you should know each and every component and its role as well. Okay. So, for example, there are anti-calculus, or we say the tartar, anti-tartar, or the tartar control product in it. For example, the constituent is pyrophosphates. So you should know what's the function of pyrophosphate. It is tartar control. That means it does not allow the mineralization of plaque, okay, into the calculus. So we call it anti-calculus, or we call it tartar control. Okay. So pyrophosphate has a role to play. Likewise, we have the antibacterial agents. Okay. We have the flavoring and coloring agents, especially for children. For example, toothpaste you must have seen have are there in the strawberry flavors and other flavors and different colors, attractive ones. Why? Because we want them to use it for their acceptability, for getting attracted towards the toothpaste, so that they use it, they are comfortable with it. So that is why flavorants and colorants are also added. Even there is desensitizing agents such as potassium nitrates in the toothpaste. So there are different components of a toothpaste, and each one has a role to play. So you should know all of them. So for children, of course, we can recommend fluoridated ones also, but in certain quantities. Okay, that you have to remember. Plus, the abrasives will be low in that, and you have to recommend twice daily toothbrushing, as you know already, and brushing. Okay, you have to recommend to the parents that brushing. That means your toothbrushing should start as soon as the first tooth erupts in the oral cavity. That is, from starting from right from 6 months of age, right? Because the first primary tooth will be erupting. So tooth brushing will be initiated and started at right from the 6 months of age. That is, as soon as the first tooth erupts, right? Now, if you find that patient, I mean the pediatric patient, the young child is having, is at moderate or high risk of having caries, okay, then we will recommend the fluoridated toothpaste. All right. But here what's important to remember is the size or the quantity of fluoridated toothpaste. It's not the simple toothpaste, it is fluoridated, so the quantity will matter. So under 3 years of age, okay, you will recommend as small as a rice grain, or a smear size, we call it, okay, of the fluoridated toothpaste. And when you talk about 3 to 6 years of age, we will recommend small, pea size of toothpaste quantity. Okay. So this quantity is very important. You have to know it and recommend accordingly. So there is something called as a plaque disclosing agent. What's that? That's a chemical or a solution or a tab which is given, to a patient, and we that identifies the plaque on the tooth surface. Okay, you give, if it's in a tablet form, we give a tab and ask the patient to chew it, okay, and swish around the mouth for 30 to 60 seconds, and then they spit it out, and then you find something like this, as you see in the picture. Okay, the purple color which you see right around the cervical margins of the teeth, wherever it is stained, no, it will stain only the plaque. That means those surfaces on the tooth surfaces which is having plaque. So we can identify, okay, these are the surfaces where the plaque is present. Okay, that is why it's called as the plaque disclosing agent. It identifies the plaque. Now, these are the names you have to remember, like the iodine, basic fuchsin, and others. These are the names, and you have to remember these names. Okay. Now, here I want to tell you that what is the use of plaque disclosing agent. Okay, you have to know where you can use it, while educating the children. For example, sometimes children may tell you, you are educating them, you're telling them that you should not have plaque on your tooth surfaces, and you need to do brushing, this and that. But they may tell you, for example, no, I think my teeth are clean, or something like that. Okay, while educating, you can use these plaque disclosing agents, either it's a tablet solution, whatever form you have. So you can use it, and you can show them the mirror. You can tell them whatever stains are there, these are the plaques, these are the microorganisms. So this is used for the while you are giving patient education. session or the counseling, right? Also, there is one more, use of the plaque disclosing agent. And what's that? That is, when you're doing researches, you'll be doing researches in future, right? So in researches, sometimes we use it to see the efficacy of any product, such as, we are, for example, we are doing a research, we are giving to one group of patients, we will give, say for example, chlorhexidine mouthwash, okay. To the other group, we may give, for example, we may recommend toothbrushing plus chlorhexidine mouthwash. And to the third group, we may give, say for example, toothbrushing and flossing, okay. Then we compare between the groups, so which one is effective, which measure is effective, right? So when we are comparing, we can use plaque disclosing agents to see the end results and all those things. You got my point? You got my point? Am I clear? All right. So, adjuncts for the plaque control. Adjuncts means what? Means that in addition to the major ones, we can recommend other, supplementary, things, like, for example, the tongue scrapers is used to clean the tongue, or we can use the oral irrigators, okay, or you can use the gauze or the washcloths in the children wherein the teeth have not erupted, and you want to recommend to the parent or the mother that even the gum pads has to be cleaned, right? So there we will use the gauze pieces. So these all are the adjunct in addition to the major ones which are used, okay. For example, the manual toothbrushing, etc. So when we are using in addition to that, we call it adjunct, okay. So coming to the toothbrushing techniques, there are different techniques of toothbrushing. To the girls, I have already, I don't know about boys, but to the girls, it has been demonstrated in the lab, and it's a little bit difficult to understand for you all here, but still you can listen to me carefully, and it will be clear to you. And to the girls, I think it should be more clear because it has been demonstrated in the lab as well. So there are different brushing techniques, okay. So there are few things which you should remember when you are talking about techniques. You have to remember few things. That is, in which condition, in which, in different situations and conditions, different techniques you have to recommend to the patients. Okay. And you have to remember the angulation of the brush. You have to remember the direction of the bristles. All right. And which motions you'll be giving to activate the bristles. So, all this you have to make a few points in your mind to remember each and every technique. Okay. So, coming to the first technique, the horizontal scrub technique. In this, what we do is we hold the toothbrush at 90 degrees to the occlusal plane, or the long, long axis of the teeth. So we hold this toothbrush at 90 degrees to occlusal plane, and we give which motion? Back and forth motion on the teeth surfaces, right? So this is the horizontal scrub technique. But we usually do not recommend this technique because it will cause abrasion. We do not want cervical abrasions and all. So we do not recommend this, but we find commonly people are, practicing the same. But as it causes the cervical abrasions, tooth abrasions, so we do not want to recommend this. All right. Now coming to the first, the phones technique. Okay. Phones technique also, we hold the toothbrush at 90 degrees angulation to the long axis of the teeth or the occlusal plane. So we hold it at 90 degrees to the occlusal plane. And here, what's the difference? We do not give a back and forth motion. No, we give the small, small circular motions on the tooth involving two to three teeth at a time. Okay, so phones technique is usually recommended in younger children. Why? Because it's easy to practice, and for them, again, I told you that for children, the dexterity, that means the power of holding the brush, is not that well developed, right? So this will be easier for them. Okay, the phones technique. So in phones, 90 degrees to the occlusal plane, the brush, and smaller motions given in circular motions on the tooth, and 2 to 3 teeth at a time are involved. Okay. For the roll method, what is the roll method? In the roll method, we hold the toothbrush in such a way that at a gum line, the toothbrush is, we hold it at a gum line, and the direction of the bristles is apical. What is the direction of the bristles? Apical, towards the apex of the root of the teeth. Okay. And here, the angulation of the brush with the long axis of the teeth is what? Is 45-degree angulation. Okay, what is the angulation in the roll method? 45 degrees angulation. And direction of bristles is towards the apex. And we give a sweeping motion from the gum line towards the occlusal surfaces. Okay, so that is a Rolls method. We do not usually recommend this, but in patients having less dexterity, or in older patients, or younger ones, or or we actually give it in addition to some other technique. Okay, I'll be talking about it further. So this is a roll method. Now coming to the Stillman's method. What is the Stillman's method? In this, the brush is holded in such a way that half of the bristles are on the cervical area of the teeth and half on the gingiva. Okay, and what is the direction of the bristles in the Stillman? The direction is towards the apex, okay, towards the apical portion of the teeth. And what is your angulation in the Stillman? It is oblique angle. That means any angle other than the 90 degrees. All right. So when you hold it in such a way that there is an oblique angle, the bristles are directed towards the apex, and the half of the bristles are on the cervical region and half on the gingiva, we then give small vibratory motions to the brush, to the bristles, and it gives a little, it removes the plaque from the cervical area, as well as it gives a gingival massage to the gingiva. Okay, that means we will be using it in patients having gingival recession. All right. So we recommend in those patients the Stillman's technique. Now, if we give a sweeping motion to the same, after doing all this, if we give a sweeping motion from the gingival line towards the occlusal surfaces, okay, then it becomes the modified Stillman. That means if we are adding the Rolls method to the Stillman, it becomes modified Stillman. All right. Then coming to the charters. Charters, is recommended in the patients with orthodontic appliances, with the bridges. So what we do is in charters, for example, the patient is having orthodontic braces. Okay. So am I audible to you? Sometimes there is connectivity issue. So I have to ask you people, am I audible to you? Because the chat is not seen, it is hanged. So can you write it please again? Are you able to hear me? Okay, thank you, thanks for responding. All right. So in charters, remember, charters is a little different one. Here you have to hold the brush at the gum line in such a way that the bristles of the brush is directed towards the coronal portion of the teeth, okay, towards the crown. Okay, so here you're holding it, and your angulation of the brush to the long axis of the tooth is 45-degree angulation. Okay, and you're giving small motions, vibratory motions, and removing the plaque from there. So here, what is the difference? Your direction of the bristles is not towards the apical, is not towards the gum line or the apex. It is towards the coronal portion of the tree, towards the crown, towards the biting surfaces. Okay. So this is your charter. So we will recommend charters in those having orthodontic appliances or bridges. Remember, for example, a patient comes to you and he's having braces or the orthodontic appliance in the maxillary arch, but there is no orthodontic appliance or braces in the lower arch, that means the mandibular. So in such case, we will recommend charters in the maxillary. Okay. But if the gingiva is normal, healthy, and dexterity of a patient is good and all, so we can recommend for the mandibular, for the same patient, for the mandibular, we'll be recommending BAS or modified BAS. Got my point? All right. So we coming to the BAS or the modified BAS. Now BAS. In this, if a patient is having healthy gingiva, okay, and not only that, but the dexterity is also well developed. There's no defect, nothing. Okay, he's normal, and he's also, means good age. That means he's not having less dexterity in the hand. That means the grasping power is also good. In such a patient, we will recommend BAS or the modified BAS. This is a AD specified, you know, toothbrushing technique. Okay, wherein the brush, we'll hold the brush in such a way, okay, at the such a way at the gum line that the we will give a little what will be the angulation of the brush. First of all, will be 45 degrees angulation to the long axis of the teeth. Okay, and then what will be the direction of the bristles? It will be towards the apex, apical again. Okay, and here, what's the difference? Difference is that here, you give a slight pressure to the head of the brush, okay, with a finger, which is the hand is holding a brush, no? With a finger, we'll give a little pressure on the head so that these bristles, they go interproximally at the embryo areas, okay? When they go a little interproximally, then we give, small circular or the vibratory motions, involving 2 to 3 teeth at a time, giving around 10 to 20 strokes, okay, at a particular, specific this area involving 2 to 3 teeth, and it removes the plaque from there, right? And now, if you give a sweeping motion from this gum line, okay, towards what? Towards the occlusal surfaces, or when we are talking about the anterior teeth, towards the gum, biting surfaces, right? So then it becomes the modified BAS technique. All right. So these all techniques you should know. You should know, for example, for children, we recommend phones one. You should know if there is a patient having recession, which technique to recommend. If there is orthodontic appliance, which technique to recommend. If the patient is healthy, having good dexterity, which technique to recommend. So all this you have to know, and the angulation, the direction of the bristles, the angulation of the brush, the situations wherein it is used, the motion which you have to give. All these points, if you keep in mind, it will be easy to remember and learn. Okay? Are the techniques clear to you all? Are the techniques clear to you all? Okay, thank you. There's only one or two students, I think, who are listening. The others are, I think, they are preparing their exam or something. Okay. All right, Gadi. All right, thanks for responding. So coming to the flossing, okay, flossing, as you know that interproximally we will remove the plaque using the floss, right? So now again there are two techniques: the spool method and the loop method. You will recommend both. I mean, you will demonstrate both to the patient, and whichever technique he or she is comfortable with, they can use that. Okay. So in both the techniques, the size of the floss which is used is the same, that is 18 to 24 inches. And now if we talk about the spool method, the first picture which you see shows the spool method. For example, in the spool method, what we do is that we take this floss, for example, 18 to 24 inches we have taken, okay, and we wind the floss on the middle fingers of both the hands, all right. And we keep, here as you see in the first picture, we keep around 2 to 4 inches free in between the two hands, which can be manipulated and used, okay. Now, after winding it on the middle fingers, we are now using and manipulating this floss, okay, which is kept free in between the two hands. We are manipulating it between the middle finger, I mean the index finger and the thumb. All right. Now, after holding it like this, we are to recommend to the patient that they should not abruptly, they should not try to pass it abruptly, between the two surfaces in such a way that it may give a gingival cut abruptly, right? No, you have to tell them that they should do a back and forth motion to the floss so that it easily passes between the two teeth, the contact areas, and it goes apical to the contact areas. Then you have to tell him to go again deep down and little beneath the gingiva also, and there the tooth, the floss is to be holded in such a way that it makes a C shape towards the tooth surface, all right. And we give up and down motion to the floss. It will remove the plaque subgingivally also, all right. And then to the adjacent tooth, again we will make a C shape towards that tooth and give a up and down motion, and it will remove the plaque from that. Then again, for another two adjacent teeth, we will use a fresh floss area, right? So this is your spool method, okay? In the loop method, what we do is that we tie a knot at the ends of this floss which we have taken 18 to 24 inches. We will now tie a knot at the end, making a loop. As you see in the second picture here, you can see the loop, is found between the hands, isn't it? By tying a knot at the free ends, right? So then we hold the floss in two hands in such a way that fingers are on the one hand and thumb on the other. Then we manipulate in the same way as in the spool method. Okay, to and fro motion going between the teeth, then C shape, and then up and down motion subgingivally. Okay, so all this is same, but what is the difference? Difference is in first one we do not tie a knot. In second one we do tie a knot, making it a loop shape. Okay, if you find gingival cuts or any this cervical wear or soft tissue clefting or some bleeding, so that means patient is doing it wrong. So you have to recommend the right technique. So coming to the chemical methods of plaque control, we have antiseptics, the agent, and these antibiotics, the enzymes, the plaque modifying agents, and these sugar substitutes. So for any chemical, plaque control, for that, say for example, a mouthwash, okay, or any chemical agent which you are using, how do we say that it's an ideal one, that it's a good one? Okay, so you have to remember certain properties or characteristics for this mouthwash or the chemical agent to be an ideal one. Okay, and what are they? They are it should be specific to the pathogenic bacteria. Okay, that means it should be functioning or working against the pathogenic bacteria, right? And its substantivity, its chemical stability, it shouldn't have any adverse reactions, it shouldn't be toxic, it should be environmentally safe, it should be easy to use. Okay, what is substantivity? That means, its binding property to the oral structures, hard and soft structures, that is called as substantivity. When it is good, what will happen? Then only it will act. right? Its binding capacity. All right. Then it should be chemically stable. Means what? Means that when the reactions are going on, it shouldn't change its chemical property, right? And it should not have any, side effects or adverse effects. It shouldn't be toxic. It shouldn't be, harmful to the patient. And easy to use and environmentally safe. So all these characteristics will make it an ideal one. So it can be mouthwash, the dentifrices, the chewing gums, lozenges, capsules. All right. So these are the antiseptic agents. These are the classifications which are being given. So here, nothing to understand. Just remember the names. For example, positively charged organic molecules. These are the names given. Likewise, the non-charged phenolic agents are given. So remember the names. Okay, oxygenating agents, the halogens, the heavy metals, and all. So you should be able to know. For example, if you are asked chlorhexidine, so you should be able to know that it's a bisbiignite and it comes under positively charged organic molecule like that. Okay. So here I want to tell you that chlorhexidine has been called as a gold standard. Okay. Why? Because chlorhexidine is, it's not only if effective against bacteria, but it's effective against array of microorganisms such as the fungi, the yeast, okay, the viruses also. Okay, so it has been called as a gold standard, a good one. All right. Yeah, because it's having good substantivity. All right. And at lower concentrations, the chlorhexidine, it is bacteriostatic, and at higher concentrations, if it is bactericidal. Means what? What is bactericidal? That means it can even kill the bacteria. Okay, it increases their permeability of the cell membrane, and hence the intracellular matter of the bacterial cell is, leaked out, and hence it causes the bacterial cell death. So it is bactericidal as well at higher concentrations. Okay, so chlorhexidine is known as the gold standard, and it has certain good properties, and it's very effective. All right. So antibiotics are also used. The names you have to remember, but of course, due to the antibiotic, resistance, or the drawback is that it may cause resistance. So we do not recommend it, often. Likewise, there are enzymes, that will cause degradation or the breakdown of the matrix of the plaque, right? So it will not allow the plaque maturation. Likewise, there are plaque modifying agents, the sugar substitutes, the plaque attachment interference agents are there. So, all these names you will remember. So, there is one more thing which you have to know in this lecture, and this is an important one, that there is a specific home oral hygiene instruction. That means when the patient is coming to you, okay, so, you have to recommend to the patients the certain, you have to give counseling that is known as oral hygiene instructions you have to give. Okay. But remember that we cannot give, we cannot give generally the same instructions to all. No, you have to customize it to different patients. Okay, the counseling which you will give to infant will not be same as the counseling which you will give to a school going children. You got my point. So that is why we say that it has to be age specific. All right. So here, if you talk about the prenatal counseling, what's it? Prenatal counseling means before the birth of an infant we give the counseling. Okay. So, and what's that? That is the, for example, when the mother is expecting, okay, remember that at that stage they are more receptive, they are more ready to take the, your counseling and guidance. So at that time, it's an appropriate time wherein you can give all the guidance, such as you can tell them that they should not, the mothers usually have a habit to share the, spoons and food items, etc., with their infants. Okay, they should not share the spoons, etc. Why? Because there is, something called as vertical transmission of streptococci mutans. Okay, we have to discourage that. Why? Because if they share, for example, a mother, okay, is sharing the spoon with the infant, okay, the same spoon she's putting in her mouth, then she's putting in the infant's mouth. What happens is that in her mouth, as the bacterial load will be more, maybe there are many caries and bacterial load is more, what happens is streptococci mutants will transfer from the mother to the infant. Okay, so this is known as vertical transmission of streptococci mutants. Okay, so we have to recommend they should not share such things with the infants. We have to tell to the mother that when the infant will be born, when your child will be born, even before the tooth erupts, you have to clean the gum pads and all for the child using gauze piece. So all this can be given at a prenatal stage. Okay, that is called as prenatal counseling. That means before the birth. Now, infants means 0 to 1 years of age. Okay, in that we can tell to the patient that they should the parents, that they have to clean, for example, before the tooth erupts, start from the birth till the 6 months, they have to clean the gum pads, upper and lower both, using the wet gauze pieces. Okay, and you have to tell them about the as soon as the tooth erupts, they have to start toothbrushing. Okay, then you have to tell them that after feeding especially, they have to clean the gum pads, and if there is a teeth, they have to brush the tooth. Okay, all this will be counseled at the infant stage to the mothers. Okay, now for the toddlers, that is 1 to 3 years of age, at 1 to 3 years of age, you can the parents, or the caregivers, they have to do the lap, or in a lap to lap, they can adopt the lap to lap position. That means one parent can the toddler has to be lie down in such a way that the extremities are controlled by one parent, and the head has to be kept in a lap of the mother, say for example, and then she can do the toothbrushing for that toddler. Okay, and if of course the toddler is at higher risk of having caries, so then they can recommend the fluoridated toothpaste. And now here, what is important, for you have to recommend that at 1 to 3 years, what will be the size of the toothpaste or the quantity of fluoridated toothpaste? It will be only smear size, as small as a rice grain, right? So all this you will say at a toddler stage. Now, at the preschool age, that means 3 to 6 years of age, the parents can now, stand behind, or a caregiver or a mother can stand behind this child, this toddler. I mean, the preschool age, that means 3 to 6 years of age, this child, and then do the toothbrushing for this preschool aged child, right? So here also they can, if the child is at moderate to high risk of having caries, then of course fluoridated toothpaste of pea size can be recommended, right? So the parent is the main, of course, primary oral health care giver, provider. So you have to counsel to the parents or the mother, right? Now, the school age children at 6 to 12 years, now the child will be able to do the toothbrushing by himself or herself. Okay, at a school age children, at a school age. Why? Because now they have a dexterity, they can understand, right? So, but here parents again have to play a role, that they have to actively assess, they have to actively check whether they are doing it properly, whether they are covering all the tooth surfaces, cleaning all the tooth surfaces, and all those things. Okay, parents have to take the active participation. All right, but child can himself do it now. All right. And then adolescent age group, that means 12 to 19 years of age. What will happen? At this age, you know that it's a stress level period for a adolescent. More of stress. Even the dietary habits will have changed, and it may be, they may be having more junk and more sweets. And also at adolescent stage, they are undergoing hormonal changes, right? So all this, again, they are at high risk of having caries. Okay, so what's your role? You will recommend to them the mouthwashes, the toothbrushing, everything. So how, what techniques they can employ, all this. Your communication skills which you are employing with the patients while giving your education and counseling will have an impact. Remember this. All right. Your communication skill is important. We cannot, when you ask the patient how they are doing their toothbrushing, when they tell you, even if it is wrong, we cannot, hurt their sentiments. We cannot tell them, for example, that no, it's wrong. No, not like this. We have to be polite, compassionate. We have to tell them, let me show you, how better it can be done. Like this, polite language. Okay. So this communication skill, when you are utilizing, in such a ways that the patient, now builds some trust in you, and of course he or she is going to follow your instruction. Okay. So that is important. Now, that's all. I mean, this is all we are being doing. That we have to, when a patient comes to you, you have to understand their concern. You have to then, use the protocols, whatever is required. If, in clinics, oral hygiene, oral prophylaxis is required, you will do that. In addition to that, you will give education. You will give them all the instructions, age-specific oral hygiene instructions. All this will be done, and then dietary counseling, of course, is also important, which you will be doing. Okay, you will be doing all this in level 9, inshallah. Okay, whether you'll be dealing with the patients, and for each and every patient, you're going to give dietary counseling, the oral hygiene instructions, everything. Okay, so then we will do a follow up. Why? Because, of course, we want to see the results. That means we want to see whether the patient is following the instructions or not, how well he is doing it, right? So we have to recall the patients as well. So every dental practitioner should make it, the oral hygiene and the preventive care, their, part of their dentistry. And by listening to, educating, adapting to, and motivating the patients and their parents, preventive practices, implementations, then only it will be successful. Okay, thank you. So it's that's all for today. Any doubts, kindly write in the chat box. Is everything clear to you?